Thanks very much for joining us today, everybody. Once again, in the radio room here in Regina, we have Premier Scott Moe along with Dr. Shahab. Joining us via video link in Saskatoon is Dr. Susan Shaw from the Saskatchewan Health Authority and Scott Livingstone from the Saskatchewan Health Authority. Premier Moe will have an opening statement, followed by an opening statement from Dr. Shahab. Premier Moe.
Well, thank you very much. And today, the Chief Medical Health Officer has confirmed 13 new cases of COVID-19 in Saskatchewan, bringing our total number of cases to 206. Saskatchewan has now conducted 11,395 COVID-19 tests. This means that the Roy Romano Provincial Lab processed 867 tests in the last 24-hour time period. That is the highest number of tests processed in a single day to date. This also puts Saskatchewan at the second highest rate of testing per capita of any province in Canada, behind only Alberta. This is good news as we work to ramp up our testing and our contact tracing efforts. Low numbers of new cases alongside high numbers of tests means that our efforts to reduce the spread of COVID-19, those efforts are working. And it serves as an encouragement for each of us in this province to remain diligent in our individual efforts. We need to continue to practice physical distancing. We need to keep washing our hands and to keep listening to the sound advice of Dr. Shahab, Saskatchewan's Chief Medical Health Officer. Later today, I'll be on a conference call with Canada's First Ministers and the Prime Minister of Canada, and just 10 minutes ago, I finished chairing a call of Canada's premiers. Canada's premiers remain committed to working together as we all fight the spread of COVID-19. And we will be taking a message of collaboration to the Prime Minister and to the Deputy Prime Minister later this afternoon. As premiers, our main priority continues to be surrounding the procurement of personal protection equipment. While Saskatchewan has been working diligently to procure the equipment that we need, it is important that we work together as a nation to ensure that each jurisdiction is working in tandem and working collaboratively. I've also heard some of the comments of Premier Doug Ford earlier today. Premier Ford was asked about the modeling that had been made available in his province, and he said that the people of his province, well, they deserve the same information that he has. And I agree. The more information that we are able to provide to the people of Saskatchewan, the better informed that we will all be as our province works to reduce the spread of COVID-19. So along with the Minister of Health, I have asked the Saskatchewan Health Authority to provide a briefing to the public through the media early next week. This briefing will include models and it will include projections of the spread of COVID-19 in Saskatchewan and an update on the steps that our health system is taking to expand our capacity for surges due to COVID-19. There are projections and modeling that are being done here, and there are projections and modeling that are being done across this nation to try to predict and plan for the number of cases we may have and the number of hospitalizations that we may have. And I expect that what you will see will be a pretty wide range of scenarios. And we have all seen some of those projections that are being made in other places, and you know, as I do, that they vary wildly. And that is because there are so many factors that impact these projections, like how quickly physical distancing measures were being enacted, and how closely people were following these measures, whether the population is densely populated or sparsely populated. Each of these factors and many more affect the outcome of this modeling. And that is why it's so difficult for us to do modeling and to predict cases with any degree of certainty. So I expect that we will see a range. Our health system will plan for larger numbers of patients and how they will be prepared to deal with the potential massive surge of cases and hospitalizations. We will be prepared for that. At the same time, the rest of us need to keep doing everything possible to ensure that that is not the case, that we keep the numbers as low and as manageable as possible. We owe it to our healthcare workers, and we owe it to one another What we are doing so far is working, but that will change if we let our guard down too soon. So once again, I say to each and every person in this great province of Saskatchewan, thank you. Thank you for what you are doing. Thank you for what you are doing to flatten the curve and to reduce the spread of COVID-19. You are saving lives. Dr. Shahab?
Thank you, Premier. So I'll just go over some of the details in the numbers. So as we know, 30 new cases, bringing our total to 206. 36 individuals have recovered. Among the 206 cases, we know that 96 are travelers, 44 community contacts, mostly from mass gatherings, 10 have no known exposures, and 56 are currently under investigation. 4 remain hospitalized, 2 in acute care floors and 2 in ICU. Of the 206 cases, 103 are in the Saskatoon area, 44 in Regina, 38 in the north, 9 in the central part of Saskatchewan, 9 in the south, and 3 in the far north, so dispersed throughout the province. In the age range, 6 cases are 19 and under, 93 are in the 20 to 44 range, 74 are in the 45 to 64 range, and 33 65 plus range. 55% are males and 45% are female. And as per yesterday, 3 deaths due to COVID-19. Our testing rate numbers continue to remain high, and they're meeting the needs of anyone who needs to be tested. And I just wanted to emphasize that there was a question yesterday around long-term care facilities. So I have confirmed that long-term care facilities regularly test for COVID-19 if there's a case with respiratory symptoms or an outbreak, and there have been no cases so far in long-term care facilities. And we got some feedback about small group settings or interactions between households. So I just want to clarify again that we do emphasize that you minimize unnecessary interactions between households for the most part. If you're outdoor, going for a bike ride with a friend, as long as you're maintaining that 2-meter separation, that's really important. Handing things back and forth seems to be a risk factor, whether in a household setting. So within a household, obviously you're living together, but between households or in a social setting, when you're handing things back and forth, whether it's a sporting item or whether it's a game, that seems to be a risk that we've seen transmission happening in those settings. So you maintain your physical distance even if you're interacting when outdoors, for example. But otherwise, remain connected through video, phone, or social media as much as possible. So basically, this is just trying to emphasize that we are at a critical point, as the Premier said. We have seen significant surges, not just in Europe, but in other parts of North America now as well. And so far, we appear to be fairly stable, but it's really important that we continue to maintain that discipline for the next little while and make sure that we remain as low as we can in terms of our daily case numbers. Thank you.
Thanks very much, Doctor. Operator, do we have a first question from the line?
We have Adam Hunter with CBC.
Hi there. I'm wondering, we have Ontario and Alberta have both disclosed the number of healthcare workers who have tested positive for COVID-19. Is there a plan in place for Saskatchewan to do something similar? Why or why not?
Scott Livingstone on the line.
Maybe I can.
Okay, go ahead, Doctor.
So we are looking at our exposure data, and we are aware of the following numbers. We know that there were 11 healthcare providers and their family members who were exposed at an event. So that happened, more than 2 weeks ago. And then we are aware of at least 6 instances where individuals may have been working in a healthcare setting, but it's not clear where the exposure was because they were not, in 2 cases, they were not involved in direct patient contact. So the exposure could have happened in a community setting or in a healthcare environment. We also are aware of 4 instances where care was being provided in a primary care setting, but there was that flag wasn't brought up that someone had respiratory symptoms and appropriate PPE was not being used. So I think this is an important thing we all have to remember now, that we can't just put on a mask if there's history of travel. If anyone has respiratory symptoms, they should call ahead before visiting a primary care practice. A lot of care is safely provided now through telephone and video consults. But if you do need to be assessed, you should call ahead so that appropriate PPE can be used. Appropriate PPE is used in assessment centers, and to my knowledge, there's been no transmission in those sites. And within the hospital setting, there's been very appropriate use of PPE and no transmission in those settings as well. And I'd like to confirm from Dr. Shaw if she would like to add anything in terms of use of appropriate PPE and transmission to healthcare workers.
I think the key thing is exactly what Dr. Shahab was saying, is making sure that when we are working with a patient who has respiratory symptoms or risk, that we use the appropriate PPE to protect ourselves, and that healthcare workers are being prioritized in the testing, and because of the importance of making sure that we know what's happening with our staff, as Dr. Shahab has reported.
I would just add to that, has been discussed here a number of times, healthcare workers are continuously self-monitoring themselves for symptoms or exposure, and are self-isolating when that is required. We have had healthcare workers that have tested positive due to an event. I go back to the curling bonspiel in Edmonton a couple of weeks ago now. It would be the expectation that we would disclose all of the information that we can as we find our way through this pandemic here in Saskatchewan. We have been disclosing, for example, correctional workers that have tested positive for COVID-19, and as we move through the days, it would be the expectation of the government that where we can disclose these numbers, such as healthcare workers that have tested positive, that we do that through the media to the public. It's important to be as transparent as we possibly can, and that includes disclosing numbers like this.
Do you have a follow-up, Adam?
Yes, I'm wondering, Manitoba today announced that they're expanding the use of PPEs, not just for people that are on the front lines in hospitals, but also people in long-term care facilities, health centers, nursing stations, COVID testing locations. These are masks and PPEs. I know that we say we have enough, but is there a decision being made to expand the usage, not just for someone that may be facing someone with respiratory difficulty, but just across the board to expand the use to prevent the spread? Thanks.
So, Dr. Shaw, I can speak to it, or would you like to speak to it first?
Well, I can say that within our Emergency Operations Committee, we do have a team of infection prevention and control, occupational health and safety, infectious diseases, and frontline clinicians that are working to review the literature on a regular basis. I think that they are considering looking at expansion of PPE beyond what the current practices are. Primarily because we want to understand how best to protect the patients from getting infections from us. And so that's the evidence that's coming out, whether it be opinion pieces or actual research, tends to suggest that wearing a mask outside of the current guidelines can improve a sense of safety, which I think has a value attached to it for healthcare workers, but also helps healthcare workers not infect patients. So it's actually a very different way of looking at these. So like I said, we have a committee that's looking at this and making sure that when we consider these options, that we're considering them based on what's best for the public, what's best for the staff as well. It's always going to be continuously reviewed.
I would just say, Adam, this was also a discussion of all of the premiers on a call that I was just on with respect to is there an opportunity for us to look to further align and standardize the use of personal protection equipment across the nation, understanding that there is a limited supply of it, but also understanding that we're working together to procure enough of it for all of our health workers across the nation, and to align the usage of that equipment.
We'll go to our next question on the line, operator.
We have Alessandra Carnero from CTV.
Hi there. Yes, my question is for Susan Shaw. I'm actually wondering what you can tell us about the triage committee currently being developed to determine who gets a ventilator in our province. Can you tell us more about it?
Well, I think that fits into a larger discussion about how the health authority has an obligation and to have an ethical framework that guides all decisions made within a health authority. It's an organization practice. It's an expectation of Accreditation Canada, and we've had one within our health authority since near the start of our formation. From that, you can expand out to always be applying ethical frameworks and decision towards a variety of scenarios and considering where we are. It's appropriate and responsible to have a set of guidelines on how a health organization and how healthcare teams can make good decisions at all times, and in particular at the time where you may have scarcity of resources. When you look at how that may be operationalized or actually done in real time inside a pandemic scenario where you may have more people needing care than you have the ability to actually take care of, should the flattening the curve not be as successful as we all are aiming that it would be, then having a triage committee or a support committee, which is a team of clinicians and ethicists, actually help healthcare providers make consistent decisions, aiming for the best results, saving the most lives and life years in a transparent and accountable and fair way.
I would
So
just...
we're starting to have discussions within the health authority, and we've been talking about them. We've been getting lots of questions, and I think there's a responsibility when we get questions to be able to answer them as honestly as we can. We have been working on what that would look like in the health authority, and again, I want to re-emphasize the importance of flattening the curve, of preventing the need for a health system to actually go into the most extreme stages of a pandemic, because that's the only scenario where we would actually need to make such difficult decisions.
And this is important work that the Saskatchewan Health Authority is undertaking to ensure that we are prepared for the most challenging situation. But it also speaks to the importance of the efforts that we are making across the province and Saskatchewan people are making to flatten the curve. The efforts that they are making in limiting the size of your gatherings, physical distancing of 2 meters, the efforts that we are all making in just personal cleanliness and keeping our hands, washing our hands many more times than we otherwise would. So Saskatchewan is doing the important work to ensure that this is not the situation that will actually arrive here. Although we need to prepare our healthcare system for the most challenging situation that we could be presented with.
Do you have a follow-up, Alessandra?
I guess more around, how will we know when you can decide who gets a ventilator and who does it? I guess so far you can't tell me how that process will work.
It'd be based on how many patients are currently within hospital, how many patients are needing care, and how much capacity there is in the healthcare system. So as we've said before, we've been preparing for months, and in the last few weeks, some very intense focused efforts on understanding what surge capacity is required. We've been talking a lot about what models that are planning tools could tell us about how much capacity we may need to prepare for in, again, a worst case scenario when flattening the curve isn't as successful as we all are trying and aiming for it to be. And so when we move into, just as a pandemic has phases, ethical decisions have phases as well. So right now, it's very much the same amount of shared decision-making with all patients and families and care teams because we have capacity. As Dr. Shahab said, I think he mentioned there are 4 patients in hospital, only 2 of whom are in intensive care units. We're planning to be able to expand beyond the 100 or plus beds that we usually have on a regular day. And we know we have lots of capacity. It's only when we get to those difficult scenarios that we have seen in other parts of the world that you would go into such a difficult situation of having to make decisions together in a different way.
And we'll go to our next question on the line. Operator.
We have Lisa Schick with CJME.
Lisa, do you have a question on the line? Operator, I think we'll go to our next question.
We have Guy Quenville with CBC.
Yeah, hi, thank you. The Premier mentioned at the outset that he's asked the Health Authority to give an update next week on the modeling. I want to ask about another aspect of planning, which is the sort of preparedness part, looking ahead to establishing field hospitals, as well as devoting existing space in current hospitals in Saskatoon and Regina. I'm just wondering, what more can you tell us about that at this stage, specifically, in terms of specific spaces being created for COVID patients, but also spaces for continuing care to make room for COVID-19 patients?
That'd be Dr. Shaw or Scott Livingstone.
So that's a good question. I think, not only did the Premier mention that we would be doing some press conferences next week around the modeling aspect of the planning, but we will be specifically talking about the operational plan that will address this exact question: is what are we doing? What have we done? So already that with some of the reductions in elective type of procedures like surgery and other ambulatory care procedures, we've already built some ready-made capacity in the system to deal with what I would say maybe is the first phase of growth of pandemic cases. But the next phase is how we actually reset the entire healthcare system across the province to be able to deal with potential surge based on that modeling. So next week we will give an update on both, not just the modeling assumptions that we've used conceptually to help plan our response, but specifically what the response is going to look like as it rolls out on an ongoing basis throughout the COVID pandemic.
And do you have a follow-up, Guy?
Yeah, Premier Moe, you mentioned you're going to be getting on a call shortly with other premiers and the Prime Minister. We've heard that, you said yourself, PPE is the main priority, so is modeling. But what else do you plan to raise beyond those two topics as far as COVID-19 is concerned on the call, Mr. Premier?
We will talk about personal protection equipment and the procurement of that across Canada. We've been working on that at the Council of Federation table, of which we just finished a call, of which I chaired, as well as we've been working very closely with our federal government to ensure that we have the right products in the right place of the nation at the right time, and that conversation is advancing quite well. In addition to that, we will be bringing up a number of other items, some of them related to the economic health of our nation. First and foremost among those will be infrastructure investment and flowing the infrastructure dollars sooner rather than later, and being flexible with those dollars so that they can address provincial priorities and community priorities as well in our respective regions. We will also be discussing and thankful for the support that has been brought forward with federal programs over the course of the last week or two. Support for employers, support for employees, looking for further details with respect to those programs and urging the federal government to make those programs available as soon as possible, and those funds flow to Canadians and people in Saskatchewan as soon as possible. Last but not least, we will be urging the federal government to come forward with support for our energy industry as it is needed, and it is needed very quickly. The support there are levers that the federal government can pull that no other level of government in this nation can pull. Levers like they utilized about a decade ago when the auto sector was facing a liquidity crisis. Well, that is our energy sector today, and the federal government we will ask to step forward to fill that liquidity void for our energy sector here in Saskatchewan and the prairie provinces in the same way that a federal government has stepped forward before to address the concerns of the auto industry about a decade ago.
And we'll take our next question from the line, operator.
We have Lisa Schick.
Hi, I am wondering, on the Ministry of Health website, there's the table and it has number of patients with tests pending, but the entire column is all NA. Why are those numbers not being shown, and would we be able to get those numbers?
So I don't have the Ministry of Health table, but what we have said in the news release is that there are 56 patients whose case contact investigation is pending. And the way it works is that of the 206, the majority, 150, the investigations have been completed, out of which 96 cases were due to travel, 44 were due to community contacts, mostly mass gatherings, and 10 were where no known exposures were found, so local transmission, and the 56 are pending. So in some cases, it's just cases of the last 2-3 days. It takes sometimes 2-3 days to complete an investigation. Sometimes it takes a bit longer where you absolutely can't find any connection to travel or a mass gathering, but you just want to make sure. But as these investigations are completed, we will see more cases in that no known exposure category, and that actually implies that we are now entering a phase of local transmission similar to many other provinces, and hence we really need to redouble our efforts to maintain that social distance, physical distance, while remaining socially connected, limit interactions between households, be very thoughtful when we go shopping about getting what we need and coming back and then washing our hands, and otherwise, all our activities outside need to be either solitary or while maintaining that physical distance between households.
Do you have a follow-up, Lisa?
Yeah, I'm just wondering, about specifically the number of tests for COVID-19 pending, not necessarily, I guess, the investigations into their contacts.
Yeah, so number of tests, I was asked about number of tests in different parts of the province, so I'll just speak to that. In terms of our total tests, as you know, they are more than 11,000 tests have been done. But our tests have been done throughout the province. So, for example, 217 in the far north, 1,451 in the north, 724 in the central part of Saskatchewan, 4,617 in Saskatoon, 1,109 in Regina, 2,842 in Regina, 1,109 in the south. So these numbers may not be updated every day. It takes a bit of time to collate the testing throughout the province, but it does show that testing initially, obviously, when people are coming, there was more testing in Regina and Saskatoon, but there has been testing centers established throughout the province. Testing is widely available throughout the province. Testing is happening throughout the province, and I think that is going to be really important. Staying home for the most part, going out only for solitary walks or if you need to shop, not interacting between households, isolating yourself if you have any symptoms of a respiratory illness, even just a cough till you're better. If you have a cough, chills, fever, and even if you haven't traveled, calling Healthline for advice, calling your primary care provider. And if your symptoms suggest this could be COVID-19 and you should be tested, then following instructions in terms of going to an assessment center to get tested. All those things remain important. But staying home for the most part, not interacting even if you're completely well, and immediately self-isolating yourself if you have any respiratory symptoms, I think are two pillars on which everything else rests. And of course, testing and contact tracing are also important.
And Lisa, I would just add to that. There are over 11,000 tests now conducted in Saskatchewan, the second highest per capita number in the nation. Almost 40 testing sites across the province. So our access to tests has been greatly improved over the course of the last few weeks. With respect to a dash, if you would be, under the tests that we're waiting for results, I'm not aware that the Roy Romano lab, the way they're operating now, that they're waiting for any results, so it might actually mean zero, but we'll double check that and endeavor to get you an answer shortly.
We'll go to our next question on the line.
We have Mark Smith with CTV.
Hi, I'm just wondering about the Saskatchewan Public Safety Agency line and the ability for people to call in and report people who might be not following the orders. Why did you guys feel that was necessary to have that in place?
Well, the Saskatchewan Public Safety Agency is one of the entities that will do some of the triaging to actually determine if someone was out of compliance, if you will, with the not only the recommendations but the orders that have been put in place. So they work very closely and in tandem with our law enforcement agencies to triage some of those phone calls, some of those reports, and ultimately it would be a law enforcement agency that would enforce if there is in fact a violation in place. But the fact of the matter is Saskatchewan people, and I have seen this in community after community, or two communities that I have been in, my home community in Regina, that Saskatchewan people are by and large adhering to the orders that have been put forward. They're by and large adhering to physical distancing measures, and for that we are very thankful. There is always the odd individual that does not think that these orders apply to them, and that's where the Public Safety Agency, in conjunction with the local law enforcement, will manage those individual situations. But a great big thanks goes out to the vast majority of Saskatchewan people for respecting the orders, staying away from our long-term care homes, our hospitals, our places where our community's most vulnerable citizens are, and doing the right thing on behalf of all of our families.
You have a follow-up, Mark?
Yes, I understand that a employee at a superstore here in Regina has tested positive. Is that now under investigation, and how are you guys looking to track who that person came in contact with?
So we don't, unless there's a reason to disclose, there's a public interest to disclose contacts related to a public setting, that is not disclosed. So what happens is when there's a person who is tested positive, public health will interview that person and will ask, were you working while symptomatic? And usually they go 1 to 2 days before symptoms start, and they assess who were the people who were in contact with the person at the place of work, in social settings, in the household. So based on that, if they can find all the contacts in the work setting, there's no reason to give a public advisory. But if all the people cannot be reached immediately or within a short period of time, then a public advisory is given. So in these kind of settings, if there's concern that all the people who may have come in close contact with the person who was symptomatic, or maybe a day before they develop symptoms and may have been at work, that will happen. But generally what we have seen is that people who work in essential services do, the recommendation is that they self-isolate at the first sign of symptoms, and most people do so, minimizing any exposure in a public setting or in a essential workplace like healthcare or grocery stores or those kind of settings.
I would say that this is, not to speak to this specific case, but this is an example of community transmission that we have said is now in our communities, and we should assume it is in your community here in Saskatchewan. This is why we have increased the resources and the people available to track, to do our contact tracing with those that have been ID'd or had a positive ID with respect to COVID-19. And this is why we have altered, if you will, or refocused our testing initiatives and our testing efforts, ensuring that we can do the appropriate contact tracing, test those individuals that have come in contact with an individual that has tested positive for COVID-19. This is why there's been an important shift in the resources of the contact tracing, as well as where we are focusing our testing resources on.
We'll go to our next question from the line.
We have Rob Mann with Discover Estevan.
You guys can hear me all right?
You bet.
Okay. I've got a question for Dr. Shahab about the nature of recovery in the province. We're seeing more and more people recover from COVID-19, and I'm just wondering, what should people who have recovered do to protect themselves and others? Once recovered, can you get this virus a second time? And if not, can you still spread it to other people?
Yeah, that's a really important question which is being researched. At the moment, the recommendation is that obviously it's very positive to see the vast majority of people who get COVID-19 recovering, and we have 15% or 36 individuals who have recovered, and we expect to see that number rise. Obviously, there's a lot of research happening right now through new tests that are becoming available, like serology, not yet licensed in Canada, to see what kind of antibodies do you develop, are they protective against reinfection, and if so, for how long. But at this point, the general advice is that everyone should actually behave exactly the same once you've recovered for the time being. But obviously, we'll know the next weeks to months about what sort of immunity people develop, whether some people develop a stronger immunity, maybe if they're young and some who are older and immune compromised may develop a weaker immunity, and what that means in terms of risk of getting a future infection either in the short term or long term. So I think those are important research questions that are being addressed.
And do you have a follow-up question, Rob?
I do not. Thank you.
Great, and we'll go to our next question on the line.
We have Global Regina.
Hi, this is Roberta from Global. I just had a question regarding the healthcare workers data you mentioned at the beginning of the call. You said that 11, I just want to clarify, 11 were the doctors and their families that attended the Bonspiel in Edmonton, and there are 6 other healthcare workers that work in primary care settings that have tested positive for the virus. Is that correct?
So without going into specific details, I'm aware of 6 instances where either people are working in a healthcare environment or were providing primary care services. So exposure may have happened in some cases either in the community or in the healthcare environment, but in at least 3 instances, the issue was that there wasn't this clarification that a person has respiratory symptoms and appropriate PPE. There wasn't that opportunity to use appropriate PPE. And I think this is a reminder for all of us as citizens and as patients that we need to do our part to keep our healthcare providers safe. They are there for us. But if we have a chronic disease for which we need advice, we need to reduce traffic in physician offices. So there's lots of other ways to seek consultation, to seek services from physicians, pharmacists. But if we do need to, if you think we do need a clinical assessment, then you should call ahead, describe your symptoms, so that your healthcare provider can then take appropriate precautions. I think that's a really important message for all of us to keep our healthcare providers safe.
Do you have a follow-up, Roberta?
On a slightly different vein, we're hearing that a First Nation is potentially closing its borders in Saskatchewan to protect against COVID-19. Is this something that you're familiar with and that you guys are recommending at this point for First Nations, particularly remote ones?
I had a phone call with Chief Cameron, and yesterday was the last time I had talked with Chief Cameron, and he'd informed me that there are a number of First Nations communities that are making efforts to limit the travel into their communities, in particular in the northern areas of the province. We had a good conversation with respect to the efforts and initiatives that not only First Nations communities are taking, but also some of our northern communities are taking to protect themselves, understanding that they are much more rural and remote than many of our communities south of the tree line. So I appreciate the input of Chief Cameron, as well as a number of other chiefs that I know Minister Carr has been in contact with this morning from right across the province.
And we have time for one more question from the line, operator.
We have Allison Sandstrom with PA Now.
Hi, thanks for taking my question. I have a question about liquor stores. I know, Premier Moe, you spoke about this last week, but today we have Montreal Lake Cree Nation calling on the government of Saskatchewan to close all liquor stores. Is it time to revisit this issue? And if you're not going to close them now, are there other restrictions that you're considering?
No restrictions that we're actively considering today, as we're pleased with the fact that there's no deaths today and a relatively low number of positive IDs. So no restrictions to be considered today. We're not considering at the moment changing the policy on liquor stores. That's not to say that won't change in the days and weeks ahead. Again, this was an item that Chief Cameron had raised with me yesterday, and appreciate the conversations that I've had with Chief Cameron as well as other chiefs from across the province, and those conversations will continue, and will continue to work with our community leaders, our Indigenous leaders, as well as the advice of Dr. Shahab and our health authority in any of the decisions that we'll make as we move forward.
You have a follow-up, Allison?
Yeah, I have a different question. This one's for Dr. Shahab. It's, hopefully going to start getting warmer in Saskatchewan soon, and many people from all over the province have homes in Lake Country, where we are in Prince Albert, and further north. What guidance would you give to people who want to take their families and go to their house at the lake? Something that's advisable now?
So So at this point, I think we do recommend minimize unnecessary travel in between communities. And so I think that is the guidance right now. Obviously, as time passes and if we remain relatively flat, that guidance may change. But at this point, we do want to limit unnecessary travel, obviously between households, but also between communities as well. So from that perspective, at this point, a lot of traffic, is probably not recommended. And certainly we have to respect the fact that many northern communities are trying to cocoon themselves as best as they can, and we have a role in supporting those initiatives. But obviously, as the spring progresses and summer progresses, and depending on where we are in terms of our local transmission, those things can and should be reconsidered.
I would just urge caution in attending second homes, lake homes for recreational use. That is moving people around that in doing so may unduly and unintentionally move this virus around our province. I would urge people to not travel into provincially. I have heard it snowed up in the Prince Albert area, I understand, earlier this week, and there's people that have come in from other areas, snowmobiling, and I would just urge people, unless it is absolutely necessary for you to be traveling from one community to another community, we would ask that you lay low for the time being, lay low for the health and betterment of all of those in our community, in particular those that may be vulnerable to COVID-19.
And that's all the time we have for today. Thanks very much for joining us, everyone.